Welcome to part 3 of what is causing your lower back pain. I'm Dr. Nate, and I built this channel to help you get past your back pain and other issues to live your highest quality life. So let's jump right in. Today we're going to talk about some practical things that you can do to improve your lower back pain. In the past 2 videos, we talked about what's causing it, what's not causing it, and a few misconceptions that maybe you had. We talked about sleep and stress and movement, social activity, all of that type of stuff. So we're gonna jump into some actual practical solutions, and we're gonna get right into that. Like we had talked about in the previous videos, it is really important to understand what's going on with your pain, because if you're afraid to move because you're afraid of damaging things more or making the pain worse, then you're probably not going to move, right? And if movement is so important in recovery from any sort of injury, then you really have to address the root issue, right? So first off, we have to determine whether or not it is dangerous, whether or not we are actually causing more damage. A quick way to do that is look at how the pain started, right? And if you've had an evaluation like an MRI or an X-ray, and you've had some findings that your doctor or your physical therapist screened you out from certain more serious pathologies like cancer and Cauda-Equina syndrome, infections, stuff like that. If those things are all clear, right, then some sort of movement is probably part of the solution for you. So I'm gonna share some movement solutions right now, and we're gonna jump into it. We're gonna do some walking here. All right, so I have a treadmill, but walking outside is great too. But I think we all know how to walk, right? Well, we'll see. It can be as simple as walking, right? You don't have to walk for a really long duration of time, and you don't have to walk super fast. You can find a pace that works for you. You can find a distance that works for you. Even if you're only walking 2 to 3 minutes at a time, even less than that, you can still work on increasing your step count over the course of the day. Walking is a great thing, right? So that's one. If you can't walk, I have other videos that kind of give you some quick strategies to improve from that. So walking, if you can walk, even if it's only for a short duration, getting your step count up and focusing on improving that over the course of weeks and months, that can be huge. I know not everyone can walk, and again, I have other videos that you can watch for that if you're not able to walk, but that's a great solution. All right, so I'm gonna go and share with you another potential solution. I really like doing these ones. They're super simple. You can do them in a chair, and again, this isn't gonna be the solution for everyone. Every person is different. Some people can bend forward, some people can't bend forward. Some people can bend backwards, others can't. Some can rotate, others can't, right? So it's important and imperative to find what works for you. So one of the ones that if you can bend forward and it feels okay, you can actually just bend down like so, just kind of hanging out down there for a couple seconds and coming back up. And if that feels good, cool. You can go ahead and try that out. If it makes symptoms worse, either immediately during and you do 10 of those and it still is uncomfortable, then we're probably gonna wanna try something else. All right, so another thing you can try is cycling. So this is an upright bike. It's an assault bike. So it's a little bit different than like your normal recumbent or regular cycle, but you can try this out if you have one of these or if you have a bike. I really like the bike for people who are comfortable sitting but have trouble bending backwards. And the reason for that is, again, you kind of get moving a little bit. You can notice as I'm kind of pressing with my arms that I'm getting some rotation through the lower back. So any way that we can get more movement in that area, in your low back or mid back or wherever you're having the discomfort, movement is medicine. So as the back of my shirt says, I don't know if you can see it, there you go. But movement is medicine, and you know, this is a really good one. Walking, the bending forward like I just shared. I'm going to show some more weightlifting type exercises for those of you who can tolerate that. All right, so this next one, I'm just gonna demonstrate a deadlift. If you can tolerate bending forward and you're having some discomfort and you enjoy lifting weights, and you can do this movement without it aggravating symptoms, this is a great one. So not everyone can start with this, but some people can get right into it. So a deadlift is essentially you're just picking the weight up off the ground. The main thing, like if you have a kettlebell or a dumbbell or something, you can see that I have a trap bar over there, so you can do it with a trap bar too, or a straight bar. But for this particular one, the setup, we're going to get between, okay? So we're gonna have the weight between our legs. You're gonna kind of squat down, keep the back flat, and pick on up. And then you can just do reps with that. So you'll notice that you work your lower back and mid back doing that exercise. Again, that's not for everyone and to start with, because some people will be flared up and they're not able to do that. But it can be a really good one to just build overall back strength. Now, what I will say about that is a lot of people are afraid of lifting heavier weights because they think it's dangerous, but it's actually dangerous to not be able to lift the heavy weights. So I just want you to think about it that way. That was weird, my treadmill just turned on by itself. It is more of a risk to not be able to lift heavier weights. Now again, and the reason I say that is because you're gonna have to do tasks every day at some point that require you to lift heavier weights. And if you're not practicing that on the day-to-day, then good luck, you know, doing those heavier things. If you have to move a couch, or you're doing a move from house to house, or you have to help a friend with something or lift something at work, like prepare your body to do the things that you're gonna be doing in daily life. All right, so that's deadlifts. I'm gonna show you bent over rows next. So bent over rows, you can do these with dumbbells, or you can do it with a straight bar or trap bar. Feet with the dumbbells, you're going to have your feet together. And we're gonna bend forward in that same kind of deadlift position, kind of holding it right there. And again, this would be for people who don't have a problem with bending over, right? If your main thing is you have an issue with extension, then you can work these into your program because this is flexion, right? So the main thing with these, again, keep the back flat, not because it's dangerous to bend it, but because it's just a more powerful position and it'll feel better. And then you're just pulling up like so. So it's not pulling up out here, it's not pulling up back here, you're kind of going straight up, okay? All right, so I kind of gave you a few different options for what you can do in terms of exercises, which is great, but sometimes exercise is not the only solution. So we're gonna talk a little bit about when exercise is not necessarily the only solution. I know that you probably thought that, okay, like he's just gonna show me all these exercises and that's well and good. But like we talked about in the causes of back pain, like it's not all about exercise. Like yes, we want to move, and if you aren't moving at all, we need to incorporate more of that. But if you're having high levels of stress in your life, we need to address that too. So, you know, you can move all you want, but if you're not sleeping and you're super stressed out, then it's gonna be really hard to make those improvements. Now, physical activity and movement and exercise, they can assist with the stress, but if you're still only sleeping 3 to 4 hours a night and you're feeling exhausted the whole day, then that's something that needs to be addressed. So I have a video about insomnia that I did an interview with a sleep physician, can't talk right now, a sleep physician, and he's great, Dr. Daniel Erickson, and I'll link to that. But check that out if you're having trouble sleeping. You'll get a lot of great info from that. And then stress management, I have other videos about that, but I'll just talk about it a little bit here too. If your work life is super stressful, or your home life is really stressful, or there's something else going on that's really stressful, my question to you is, do you have stress management techniques that you use, whether it is meditation, whether it's exercise, whether it is cognitive behavioral therapy to come up with different strategies to improve upon that? If you don't, and you need some help with that in terms of the stress management, I would highly recommend working with a therapist. You can also look on YouTube for a lot of different stress management techniques. And really the kind of the stress, sleep, and physical activity side of things, they all kind of, they play off of each other, because if we're tired and we're stressed, it's harder to exercise. But if we exercise, sometimes it'll help with the sleep, it'll help with the stress. And then all the same, like if we implement stress management techniques, oftentimes our sleep will be better, and then our exercise routine will be better. And like if we don't improve those two, but we work on sleep, it can improve our stress levels and our physical activity levels. So those all play a component in how we feel. So it's really important to kind of rank which one you need to work on the most. So if you're getting a lot of physical activity, but you're not really managing your stress, then work on that. If you're managing your stress well and your sleep's okay, but you're not moving at all, then you gotta move, okay? So those are the main components. Okay, and then the last thing I want to talk about is consistency. So if you've been having pain, like back pain for, I don't know, like four weeks or less, it's likely that it'll improve with just doing some of these things. If you've been having it for a longer amount of time and you haven't really prioritized either your sleep, stress, or movement, or having healthy relationships too, then it's really important to, number one, work on those, but then to also be consistent with it. Because what I see happen often is that people are not consistent with their movement, they're not consistent with their sleep, they're not consistent with their stress management, and so they just keep going in the same pattern, or things start to get worse because they're not paying attention to those things. Part of the reason though that people, that you might not be consistent is because things aren't working, right? Try new things, right? If you're doing something and it keeps making things worse, try new things. Like keep trying new things. And I'm not saying like try a bunch of new like alternative therapies that may or may not be helpful, but try new movements. Try varying how much you're walking. Try varying how fast you're walking. Try different exercises. Sets, reps, intensity, all that type of stuff. I'll have to make another video about how to actually do like workout programming, but got to be consistent with it. So that's a huge part of improving. So consistency and doing the right stuff. So again, if you're doing things that constantly flare you up, then we need to change it. Like you just need to change what you're doing. All right, so I hope this information was helpful today. Please like this video if it was. Go ahead and comment below what you've tried, how it's worked for you, and if you're stuck and struggling and just like, what the heck, you can also click the link in the description below, and you can download our success guide, which will give you access to our free Facebook group. Has about 2,400 people in it as of making this video, and a bunch of other goodies that are all completely free. And if you want to chat with us, you also have an option to do that. So go ahead and just leave that comment below. Hope this video was helpful for you. And as always, stay strong, stay resilient, keep getting after it, and I'll see you in the next video.